So now we are going to move on to Tanya Martinez. Tanya is the Assistant DIO and Director of Medical Education at Mountainview Regional Medical Center in Las Cruces, New Mexico. Tanya?
Thank you, Chris. It's such an honor to be a part of this discussion. One of the things that I think I'm most passionate about within my role is advocating for coordinators and being able to help anyone who's interested in advancing move on to that next step. So like many of you who've shared your stories, I also kind of fell into the role of a program coordinator to start with in GME. I knew nothing about GME, knew what a medical student was, and that's about it. Had no idea what a resident was, why they existed, why the residency programs were there. And so I had a lot to learn. There's a very sharp learning curve to start. But I'm naturally someone who's very curious and I like to ask a lot of questions. And so thankfully I had people who were willing to explain everything to me and help me to just get a little bit comfortable when I first started. So I originally started in the Department of Medicine at the University of Chicago, a very large academic institution where everyone there, every single patient was touched by a resident, medical student, fellow. And so again, me not knowing what exactly a resident even was at that time was a little bit intimidating to come into this world of GME. I also stepped into a brand new position, similar to what Karen had mentioned. We had a new ambulatory chief resident who was just recently appointed at the time. And so there was a need for additional administrative support to help with the new ambulatory chief. So I started managing a lot of schedules and learned more about how that would work on the clinic side with the internal medicine residents. And slowly over time, I gave myself the time to really learn what it was that I was doing. The expectations were a little bit broad since it was a new position. And when my manager approached me about the position, I originally was doing a work study temporary position, so a few hours every week where I was helping with basic administrative tasks, filing, copying, running errands. And then as I became more and more proficient at those tasks, I asked, is there anything else I can do? I have more hours in the week that I could still be spending within the department, and how else can I help? So that ended up turning into a full-time position for me when this ambulatory support position came about. And that's something that as I was thinking about this presentation and trying to figure out how do I tell my story, what is my story, how would it help for other program coordinators who are looking to advance, I can't stress how invaluable it is to ask the questions. And if you see that there's a need out there for something to be improved upon, put your ideas out there, make the suggestions, put the pitches, because people who are in management or leadership positions, when they have a need, you'll be the first person that they contact. And very much so, that's been something that's permeated throughout my career. And just looking for those opportunities and finding how I can make myself a valuable asset to the team that I'm currently in, not even looking forward to that next step, but other people will notice if you're that type of person. And so that's been something that's been really crucial. As I was thinking about my career path, I started out with this very large internal medicine program that was extremely well established, but still room for growth. Still opportunities to innovate and create along the way. And every other position that I've had since then, I've been the first person to be in that position. So it was a new position that was brand new, created, and that gave me a great opportunity to create it the way that I wanted to. So after I had been at the University of Chicago for a number of years, felt that I was kind of at the point where I was ready for a change, that I had done all the projects that I wanted to, made all of the process improvements, and I was looking for something new. So I started looking elsewhere within the community within the city of Chicago, which is thankfully a large city. But I wasn't really finding what I was looking for. I wanted something that was a little bit different. So I took a risk and took a chance to move up to Milwaukee, where I was with a larger system in the state of Wisconsin. And I stepped into the GME manager position up there. The previous administrative director had been in that position for 46 years. So I had some very, very large shoes to fill, which was exciting. Being someone who is naturally curious and wants to learn, it was really exciting, but it was also intimidating, very intimidating. I had program coordinators who, to this day, I still consider as experts, some who had been in the program coordinator role for over 30 years. And I was coming in brand new. I didn't even have that number of years of experience myself. And so, you know, some people coming into that sort of situation would think, how am I going to do this? And I definitely had those thoughts. But I also thought, wow, what a great opportunity to come into this team who has more experience than I do, who knows everything there is to possibly know about being a program coordinator, and then find ways to help them even more, to change things. There's always a way to change a system, to improve upon a system, to work together and collaborate. And I had such an amazing team who not only helped me, but really allowed me to help them to do their jobs even better. So after a few years in Milwaukee, I was recruited to become the founding administrative director for a newer GME program in Macon, Georgia. So I, again, decided to relocate to a brand new part of the country. For me, I had no connections whatsoever to the South. I was coming in the first hire for the entire hospital in GME. It took me back to when I knew nothing about being a resident or a fellow or anything within the education space, because all of a sudden I was the content expert. I was the person who everyone came to with every single question about what a residency program was. What's this ACGME thing? Why are we bringing these people into the hospital? Completely brand new from scratch. So again, having that mindset of thinking about things as an opportunity to really be able to create and innovate helped me to lay a lot of the groundwork for that program. For starting new applications for ACGME residency programs for the institution itself, hiring program directors, putting all of the different pieces into place for brand new GME. Of course, that's part of the HCA system, and I'm sure everyone here is now aware of the massive plans that they have and have been rolling out around the country. But we were really one of the first institutions, one of the first hospitals to do that. So there wasn't as much of a national presence or infrastructure like there is today. So we were able to help put all of those pieces into place in a way that made sense for that facility. So then a couple years later, I was recruited to my current position, which is the assistant DIO at Mountainview Regional Medical Center. I'm originally from New Mexico, and so this was a perfect opportunity for me to continue doing what I love, using all of the experience and knowledge that I've created over the years being in GME. And coming back to my home state. So one of the things that I think has really created and led to my success in these roles is that I feel so grateful and so passionate about being able to impact the community in a different way. So I think Karen was the one who said that she never wanted to be involved on the clinical side of things. That's definitely not my forte at all. But I know that working on the administrative side still contributes, and it's a very valuable role to how everything comes together and ultimately impacts the community. So New Mexico is is overall a pretty poor state, and we lack a lot of resources for the community. So being able to recruit new residents to the community with the idea that ultimately they'll stay in the community and practice and provide more resources for healthcare. That was something that was really important to me, to know that I have that impact behind the scenes. So I may not be out there doing the work myself directly with the public, but I know that everything that I'm doing is working towards that end goal. So I've been in this position for 4 years now. It's a lot of work creating new residency programs. We were in our second year when I started, and since I've been here, we've been able to obtain a C-TAGME accreditation for our residency programs, and now gone through the process where we have continued accreditation and we're at our full complement finally. So it's been great to see the process really from beginning to end, and see how everything comes together. Of course, there are still on a daily basis things that we need to work on, and I think as program coordinators, especially someone who's looking to advance in your career, it's really important to find those ways where you can pave your own path. Like I mentioned earlier, none of my positions existed before I stepped into them. And there are lots of ways out there that you can create your own opportunities, making yourself a valuable asset to the team, looking for different committees to join, national associations, finding those people who can really support you and mentor you, encourage you along the way. Of course, none of us do this on our own. We're all a part of a team, and that's such an important part of being a program coordinator.
Thank you so much, Tanya. And I was really happy to hear your story. I didn't know you had been at all those places. That's wonderful.
Thanks.